Okay. And Dr. Kamlesh, your patient, Mr. Daniel, 64 years. And if you ask for the examination and if there is any picture, I'll be sending in the group. Okay.
Sure.
So your time starts now. Your time starts now.
Sure. Good day, Mr. Daniel. My name is Dr. Kumar. How may I help you today?
Doctor, today when I woke up in the morning,
Mm-hmm.
this sight in my right eye was suddenly very blurry. Now I'm really worried about it.
Sorry to hear about that. Can you tell me something more about your condition?
Yes, doctor. Actually, suddenly it was blurry and then almost gone. It didn't hurt, but I
Mm-hmm.
can't see properly. And I noticed it when I woke up like around 7, and
Mm-hmm.
it seemed to come on suddenly and then left.
Okay, sure. So, uh, okay. So, is it okay, Mr. That I ask you a few more questions about your condition?
Sure, doctor.
Can you show me where is the problem in your eye?
Doctor, in my right eye.
In your right eye. So,
Yes.
can I see how your eyes look?
Uh, Eyes on the visual appearance is normal.
Okay. Is there any redness, any discharge?
No.
Okay. Only the blurring. Have you noticed that for even for a fraction of seconds you got loss of the vision?
Yes, doctor.
Okay. And are you feeling any halos around the right now?
No, doctor.
Have you noticed? Are you feeling right now any blurring of the vision that you are not able to see clearly from that eye?
Yes, doctor. I cannot see clearly, and I only see vague shapes and light out of the right eye. The left eye is
My God.
completely fine.
Okay. So have you noticed that there is any pain in that eye?
No, doctor.
Mm-hmm. And do you feel any headache,
No, doctor.
any nausea to throw up?
No, doctor.
Okay. And apart from this, is it continuous since it is started?
Yes, doctor.
Okay. And have you noticed that anything is increasing it or decreasing it?
No, doctor. It didn't increase or decrease, but I had this similar episode few times in the last month also.
Mm-hmm. And how much time it remained that time?
Doctor, I didn't notice a lot, but it stays for a few minutes, and I feel
Mm-hmm.
like a curtain over the eye also. Then it gets better
Okay.
after a few minutes.
Okay. And that's only one time last month. Apart from this, any
No,
other
doctor.
history like that?
Few times the last month.
Few times the last one.
Mm.
And then it becomes normal.
Yes, doctor.
Okay. And apart from this, are you suffering from any high blood pressure?
Yes, doctor. I have this high blood pressure and high cholesterols. Taking medication.
Mhm. Okay. And what medicine you are taking for that?
Okay, I'm taking amlodipine and
Mhm.
simvastatin for cholesterols.
Okay. And how about your sugar levels?
I don't have diabetes.
Okay. And apart from this, are you using any other medication on over the counter or regular basis?
No, doctor.
Okay. And what do you do for a living?
Doctor, actually, I have this financial problem, so I'm still working as a delivery driver.
I can understand. It's really very difficult and hard for you in this age to do like that. Uh-huh. And with whom do you live at home?
I live with my wife and two kids. They are
Okay.
university going, but they cannot take care of me somehow. I have to do my own job.
Mhm. Okay. And what comes in your mind regarding your condition?
Doctor, I thought it could be some eye infection or my age problem, but I don't know. Maybe some nerve problem.
Mhm. Okay. And apart from this, what comes in your mind specifically regarding your condition?
Doctor, now I'm scared that I'll go blind and I need my vision to drive for work.
Okay. And what you are expecting from me in today's consultation?
Doctor, is there any ultrasound for eye or any eye
Mhm.
doctor appointment I need?
Sure, we will discuss about it. And how about, so you told me like that you have these type of same attacks in last month few times, and today you are feeling since morning when you wake up, blurring of vision in your right eye,
Yes,
right?
doctor.
And you are worried about that it can be the permanent loss, and if they are in need to send to you for eye specialist, right?
Yes, doctor.
Can you just, is it okay if to understand better I do for you your eye examination?
Sure, doctor.
Okay, so I will check your blood pressure, pulse, okay, your BMI. Apart from this, I will check the acuity of your eyes. I will check with the touch, the movements of your eyes. I will make the edge shape test with your eye. I will see the conversion of your eye. I will check the back of your eye. Is there anything?
Yes, I'll pause the timer sending in the group picture.
Sure, sure. Let me check.
Your timer
Mhm.
starts again now.
Okay. So after having this all things in consultation, it looks like that you are suffering from a condition which we call uh,
Dr.
chronic.
Kamlesh,
Yes, chronic
blood
open
pressure is
angle.
one
Like, mhm,
170 by 95.
mhm,
Visual acuity is severely reduced. Pupils
mhm.
right relative afferent pupillary defect is positive. Okay.
Okay. Okay. So your condition is telling that you are suffering from a condition which is called the angle closure of angle closure, not either. So chronic closed angle glaucoma. Do you know about it?
No, doctor. What is it?
Actually, it is a condition which happens in the old patients just because of the damage inside your eye. Okay, for the nerve which is responsible for the vision. Okay, usually it happens gradually and without pain.
So,
Are
doctor,
you getting it?
it's something really bad happening to me.
Yeah, like right now you have this. There can be the many reasons for this. One is the age. Other is like you are using the cholesterol. So maybe sometimes there is some problem in the flow of blood towards your eye. Okay. So how about if I send you for the eye specialist on the emergency basis so that he can check your eye and can treat you according to that.
Okay, doctor.
Okay. For this one, he may offer you some eye drops which we call mostly prostaglandin eye drops, beta blocker. Are you suffering from any asthma or any other chest disease?
No, doctor.
Okay. And if it is not controlled with the medication, he may offer you with the laser therapy, the surgery option. Is it okay with you?
Sure, doctor.
Is there anything else you want to discuss?
So, when should I go to the
I
specialist?
will send you to a specialist right now. Okay. Is there anybody with you in today's consultation?
No, doctor. I'm alone here.
Uh-huh. So how about if you give me the number of any of your family members so that I can call them so that they will go with you?
Yes, doctor, I can call my wife.
Okay, so I will just call her. I will arrange and she can take you to the hospital. In the meantime, as you told that you have some issues with your financial. So how about if I refer you to the uh, social security services, which can help you out in your treatment?
Okay, doctor.
Okay, I will talk to them that they will provide you the support for your case.
All right. So,
Okay.
okay, Dr. Kamlesh, only 10 seconds remaining.
Because I'm not getting, I don't go through this ophthalmology and always problem for me. Anyways, I don't.
It's okay. It's okay. Today we can learn a lot of things.
Yes,
So, in the picture, what did you see?
and this pale pale phobia like this one,
Pale
and that
retina
like
along with
along with dot hemorrhage.
a cherry red spot.
Yeah,
Yeah, and
this
cherry red
dry.
spot is
It's
the
I think this is dry one, right? Red one is with the
sorry,
neovascularization. This is the I think dry what it called dry eye.
macular. No, no, no. In dry macular, there are drusen. That's a different
Versus,
thing.
yeah, that is
Yeah,
different.
here
It is
it's
a
a cherry
hemorrhage.
red spot. Yeah,
Hmm.
it's a kind. It's central retinal artery occlusion.
Viking. No, bike.
Return
So yeah,
Okay,
inshallah.
painless. Yes. Okay.
so
Viking
basically,
safe. I know her.
okay, so
Central
basically,
retinal
this
artery.
in this condition, others, please can you all mute your mics?
Yeah, now I remember because you have same in certain like in the last. So there, I think
Yes, in
I told you one
PKT we
of the reasons
studied this,
can be
right?
the blood blockage of the blood. Yeah.
Hmm.
I was
So
confused
this is
in between.
don't worry, we are discussing it right now.
Mhm,
Like the painless sudden monocular vision loss, it's pointing towards central retinal artery occlusion in this
simple.
case. Okay, how we proceed
Mhm,
from the um, history perspective.
mhm,
Just tell him to. I want to look at your eyes right now. Ask him in detail the history. What he's telling you. He said, "I just suddenly lost my sight in the morning, so dig more of it. Like how did it start? Sudden or gradual? What kind of nature that you lost your eyes?" I said, "Can you see anything? Is it blurry or is it completely gone?" The pain, do you have any pain? As you asked, headache, flashing lights, or any weakness, like especially in stroke, any speech problem? Okay, it was all negative in this case. Associations. Past similar episodes, very important in any kind of vision loss or any kind of this CVS. A few times in the last month, he had the similar episodes. So it's a kind of mini stroke in the eye. Okay. In his past medical, you asked about high blood pressures, but again, whoever is on the long term medication, ask about the compliance. He wasn't taking it, the medication on time or daily. One factor. Secondly, his family history wasn't asked. His brother had a stroke at 60. So, very importantly, they have a strong family history of stroke and an ECVA. He was working as a delivery driver, very importantly, in any sudden vision loss. Okay. So, we have to like address this concern also. In examination, you're always going to do vitals, especially blood pressure, eye examination, right eye, and visual acuity, pupils, any red eye, cornea, clear or anterior chamber, check no, check for any cataract. Okay, left eye, bilaterally, anything in the body that's bilateral, either that's lungs, that eyes, that ears, you will check bilaterally. Then you can say, I want to check at the end of the session. I want to go for your back of the eye, or you can say I just want to see your back of the eye right now. So they will give you any picture of fundoscopy like I gave you. So in this case, cherry red spot and pale retina pointing towards the central retinal artery occlusion. This is an ophthalmic emergency, you can say. Okay, in primary care we won't do any investigation. We just have to refer urgently. We can tell the patient like in hospital they will be running few tests. They will be doing your ESR, CRP just to rule out GCA or temporal arteritis, carotid Doppler, cardiac echo, ECG. You can verbalize it, but still, in this case, we'll just tell him that I am referring you to the specialist right now, as it's very important for you. And how you will manage the patient, it's a time critical emergency, so we cannot waste it over here by delaying the uh, referral. Immediately treat it as a stroke equivalent and explain to the patient very importantly how you tell the patient, because sometimes this is a drawback of in GP setting, that patient doesn't know what's going to happen or what's happening to him actually. We tell him we believe a blood vessel in the back of your eye has become blocked and it's essentially like a stroke in the eye, so I need to get you seen in the hospital immediately. Okay, and to prevent any further events, because it can lead to blindness also, so you need to go right now, and I advise you to not go alone. I am sending you with my staff member, and I'll be informing, or can you inform at your home so someone can accompany you. Okay. And if the patient is telling you sometimes there is resistance in getting admitted, he will tell you, Doctor, I'm completely fine right now. I don't have any vision problem. It could be my age related. So then you will emphasize on the seriousness that by taking his own concern, like as you think that this might go into complete blindness. So yes, Mr. Daniel, it can. If another attack, God forbid, if it happens, or it might bring you to complete blindness. So right now, I have to send you as soon as possible. Okay. Then later tell him that I really need to talk to you after you get a follow up. I want to talk to you about your blood pressure medication, your lipid, and smoking. Yeah, psychosocial wasn't asked, Dr. Kamlesh.
Yes.
Smoking, alcohol, sleep, his stress level, everything needs to be asked. Like, okay.
Yes.
Oh, this was all in this case. Sometimes sudden loss of vision or retinal artery occlusion or other factors.
Doctor, what will be the difference between the arterial and venal occlusion?
On the fundoscopy, arterial is always coming with the cherry red spot.
Yes.
So, Dr. Musarat, you mean that at this time, can we give the patient aspirin?
Here
Since
it's not
first we-
indicated in eye case. Not do you cannot do anything for the eye case. You are referring
Just
him.
proceed. Just
Okay,
proceed.
if the patient asks me what the specialist will do for me, what then we how can reply them?
Yes, you can tell that they might put you on blood thinners, and before that, they will be giving you some scans or ESR, CRP, running some bloods. Okay. And retinal vein occlusion is sudden painless vision loss, and fundus will be widespread retinal hemorrhages and dilated tortuous vein. As Dr. Kamlesh, you asked a difference between vein and artery occlusion in fundoscopy. Artery will have pale retina and red spots, where vein will include widespread retinal hemorrhage. Okay, like flames and we thunderstorm. If you remember, we studied it in AKT. Thunderstorm appearance of the retina. Okay, the other differential in this case could be temporal arteritis causing GCA. Okay, giant cell arteritis, retinal detachment, but it will again sudden flashes and floaters will be positive in retinal detachment, and not pale with cherry red spot on fundoscopy. Okay, another differential can be vitreous hemorrhage, where sudden painless hazy or cobweb vision with poor fundus view. Okay, due to blood in the vitreous rather than the pale retina. Is it clear?
Doctor, what about retinal detachment? There's also gutter like feelings in
Yes, it's
this.
also. Yes, here in artery occlusion, they will be telling you curtain-like feeling, but it went away on its own. Retinal detachment, you will still feel that curtain-like effect, along with flashes and floaters.
Okay.
Okay. In this case, like in artery occlusion, patient will be telling you that I get better and I had similar episodes previously. But in retinal detachment, this is first and foremost, and then flashes and floaters with the curtain effect and peripheral field loss in retinal detachment. Okay.
Dr. Musarat, floaters are the same as black spots scotoma. This is what we call floaters.
Yeah, flashes and floaters. Yes. Floaters, nothing will be on the retina except the detachment. If you Google the picture, you will see the retinal detachment on the retinoscope. No other finding will be on retina. Okay. So next case, Dr. Saima, you said you want to do.
Yes.
Okay. So the patient is just a moment. Your patient is Mrs. Adam. Sorry,
Mm-hmm.
Mrs. Chloe.
Mrs.
Chloe. Okay, make it easier. Mrs. Aisha.
Okay.
27-year-old female came to discuss her problem with you. Please proceed with history, examination, and management plan. Okay, your time
Okay.
starts now.
Okay. Hello, Mrs. Aisha. I'm Dr. Saima. How can I help you today?
Doctor, I have had this little lump on my upper eyelid for a couple of months now, and it just make me feel ugly.
Mm-hmm. Can you tell me more about it?
Yes, doctor, it started like it was at first it was painful. It was tender and red swelling, but then the pain went away, but this lump is still there. It's
Mm-hmm.
been 3 weeks now.
It has been 3 weeks now. Okay. So can I see it?
Okay, I'll pause the timer, sending in the group. Your time
Okay.
starts now.
Okay. So you told me that it has been 3 weeks. Am I right?
3 months, doctor.
3 months. Okay. Sorry. Like appear all of a sudden, or it slowly it appear.
Doctor, I started to increase since size gradually. It was tender and red, but then pain went away, but this swelling is still there.
Mhm. Okay, so okay, so do you feel any like watering from the eyes?
No, doctor.
Okay, can you tell me that which eye is this?
Left eye.
Okay, and what about the other eye?
It's completely fine.
Mm-hmm. Okay, any blurring of vision you feel in that eye?
No, doctor, but just a slight heaviness of the lid.
Mm-hmm. That heaviness. Okay, and any feeling of some sand like a feeling in the eye?
No, doctor.
Okay. Do you feel any like that like you have some visual like your visual acuity is decreased with it?
Mm, no, doctor. I don't know visual acuity, but my vision is fine.
Oh, okay. Okay. So, do you have any long-standing medical condition, Mrs. Aisha?
Yes, doctor. I have this oily skin, and sometimes I get mild rosacea. I have skin condition.
Mm-hmm. Okay. And do you have any joint pain?
No, doctor.
Any fever?
No, doctor.
Okay. Have you taken any thing to relieve this pain?
Doctor, I don't have pain right now, just as the swelling.
Mm-hmm. Okay. But any medication you have taken for this swelling?
And when it was paining, I took paracetamol only.
Mm-hmm. So does it work?
Yes, doctor. Now I'm completely pain-free, but it's still bothering my look.
Mm-hmm. Okay, I can understand this. Okay, Mrs. Aisha, do you have any similar condition in your family or any other?
Yes, my mom has similar condition.
Mm-hmm. What about her now?
She gets these kind of swelling in the eyes, then it gets better on its own.
Mm-hmm. Okay, and okay. Do you smoke, Mrs. Aisha?
Yes, I do.
How many cigarettes a day?
Like 10 to 15.
Mm-hmm. So, have you ever thought of quitting it?
Doctor, I don't feel like quitting it.
So, Mrs. Aisha, this is actually cigarette smoking has side effects. Okay, so if you want to quit, we will be having another session on that. And meanwhile, I will give you the leaflet about the hazards of smoking. Is that okay?
Sure, doctor.
Okay. What about alcohol consumption?
No, doctor.
Okay. Any recreational drugs you are using?
No, doctor.
Okay. So, what are you doing for the living, Mrs. Aisha?
Doctor, I work as a customer facing in a customer facing job, and I'm really conscious about my appearance.
A customer appearance. So you are working on a, like a screen that like a computer most of the time.
Yes, doctor.
Mm-hmm. I can understand. Okay. And are you married, Mrs. Aisha?
No, doctor.
Mm-hmm. Okay. With whom you are living?
With my mom.
Okay. And what about any stress at home?
No, doctor.
Mm-hmm. Okay. And what is your last menstrual period, Mrs. Aisha?
It's 2 weeks ago.
2 weeks ago. I want to ask a sensitive question. Is that okay with you?
Sure, doctor.
Are you sexually active?
No, doctor.
Okay. Okay. So, Mrs. Aisha, what's coming to your mind?
Doctor, it's just like a blocked land in the lid.
And how this condition is worrying you?
Doctor, it's just I don't want it something bad like cancer. Could it be a cancer?
I hope it's not. Okay. And what's you're expecting from me from today's consultation?
Just doctor can tell me some treatments to get rid of it. Maybe a small operation if needed.
Mm-hmm. Okay. And how this condition is impacting your life, Mrs. Aisha?
Doctor, it's really annoying me on my job, and I really am conscious. I'm trying to cover my eyes sometimes with the glasses so other people don't look at it. That's how I'm
Mm-hmm.
suffering.
Okay, Mrs. Aisha, so you told me that you have this swelling on the upper eyelid in the left eye, and you want some medication for it. Is that all, or you want something, want to add something?
That's all, doctor.
Okay, so Mrs. Aisha, you are suffering from a condition which we call as TIE. It's a condition where I will refer you to the eye specialist, and what they will do, they can remove the eyelash, and maybe they drain this pus. Are you getting me?
Okay, doctor. They will remove my eyelash.
Yes, they can remove your eyelash to drain the pus. Okay.
Okay,
And
doctor.
yeah, and they can give you some antibiotic drops as well. Okay. And
Okay, doctor.
okay, and meanwhile, you try to avoid smoking, for which I have given you the leaflet. Okay, so is that possible for you that you can think over it?
Sure, doctor. I'll think on it.
Okay, and you can. What about your BMI, Mrs. Aisha?
23.
23. Okay, and what about your dieting habits?
Doctor, I mostly am taking junk food, but sometimes I skip meals also.
Okay, I can understand. So, what if you can avoid the junk food and you eat at home? Is that possible for you?
Yes, doctor, I'll try.
Okay, and meanwhile, you can take rest for a few days so that your eye can get rest. Is that okay?
Okay, doctor.
Yeah, so I will refer you to the eye specialist. And meanwhile, if you can get a severe, pain in the eye or something, blurring of vision, you can immediately go to the eye emergency. Is that okay?
Sure, doctor.
Okay, thank you. I skipped the examination. I forget.
Yes. You still have 1 minute. Do you want to verbalize the examination?
Okay, so first I will do the first I will do the hand sanitize and then I will saffron की तो मैं खाने में ज़रूरत नहीं होगी, but under the under the privacy I will do the general physical examination. I will start from the hands, nails. I will see the pulse, blood pressure, any lumps and bumps like lymph nodes I will check, and then I will see the eye, and I will put the torchlight on the right first and then the left, and then we'll check the extraocular movements and we'll see the swelling, and that's it. And invert the eyelid, anything like that, I think.
Okay, time is up now. So, Dr. Simon, nicely done. But again, here the examination will be given as soon as you go for examination, or in the starting you ask for the look of the eye. So it was in the beginning it was given. So still, if you want to do, you can say vitals if there is any instruction for that. Vitals, no lymph nodes, no nails or anything like that. Only vitals with lids and conjunctiva and vision. Nothing else. Okay? Because it will
But
be very detailed.
but we will see
Yeah.
the conjunctiva with the torch light. That's it.
Conjunctiva and cornea can be seen with the naked eye, and the reaction of the pupil can be seen by the torch.
Okay.
Okay, but in this case, she is not having any vision loss or any disturbance of vision, so we can even skip that. Just look
Mm-hmm.
at the eyelids and it's tender or non-tender, things like that. Anyways, if we go from the very beginning, the patient is 27. She had this lump since last now 3 months. She took painkiller for it right now. It's
Mm-hmm.
not painful. So, what diagnosis did you make?
Why? Because it's external hordeum to me, I think.
Yeah. Yes. And in this case, we need to know in detail about onset, duration, symptoms, vision, and any discharge. Okay,
Mm-hmm.
you went through all of this. Past, what was the triggering factor or the thing that she wasn't getting recovered in 3 months?
Smoking, I think.
What else?
Uh, Um, um,
Her rosacea, her
Rosacea.
oily skin.
okay.
Yes.
Yes. So this was a triggering factor along with the past medical history, family history you asked, social history you asked, eyes you asked. Nicely, history work was very good. Data gathering was good. Examination was good. It's a lesion or you can say external hordeolum. Management and safety netting, how we will do. Firstly, we are not going to send this patient at all right now because she didn't go through any conservative management except the painkiller medication. We will give
Mhm.
her warm compressors for
Yes,
5 to
yes.
10, tell her warm compressor 5 to 10 minutes for 3 to 4 times daily.
Yes.
Gentle lid massage, not vigorous, and
Mhm.
it should be towards the lid margin. Tell her it should be towards downward from where there is the eyelid. Okay. Still,
Okay.
after
Okay.
1 week follow up, 1 to 2 weeks, if it's not getting better, then we can send the patient, or when it's with the conservative, it's not coming back to normal, you can then send for incision and curettage to the
Mhm.
ophthalmology, but not right now.
Okay.
In this case, it's if there is any recurrent lesion, you can say about the rosacea management, or if there is any blepharitis recurrent, then you can tell her for the lid hygiene, how wash your lids daily, try to clean it in the morning with the warm and wet cloth, okay,
Mm.
and tell her about allergens if she has any, and if she has active rosacea, we can say I want to talk to you about your current rosacea, and if that okay with you at the end of session, you can say this, okay.
Yes.
And safety netting, tell her that return if the lump rapidly enlarges or very firm, and she has any loss or ulceration of the lash, okay.
Mhm. Okay.
So this is all for this case. Again, if we go on to the differential, what could be the differentials over here?
Lesion, blepharitis, like this
Mm,
thing, or allergic. I think maybe no allergic. Uh, हो तो सकता है वैसे मे बी एलर्जिक कंजक्टिवाइटिस की
okay.
uh,
Hordeolum internum or STI, simple eyelid cyst could be, okay. Uh,
mhm.
but it's on the higher level, like epidermoid cyst. Any
Okay.
malignancy, but again, it should be after many months, or
Mhm.
it is if it is irregular. And
Mhm.
preseptal cellulitis.
Septicism, yes.
Okay, these are the differential but most commonly painless, and on the upper eyelid mostly and outward, it is chalazion.
Okay.
Okay, next case,
Can I do?
Doctor. Okay, Doctor Sumaira.
Okay. Just 1 minute. Okay. Give me 1 minute. I'm just blinking my
Sure,
pen.
sure.
Dr. Musarat, how did you differentiate it from STI? Can you repeat STI versus Clasion?
Internal and external. Internal will be STI. Externally, it's heard chalazion. And mostly on the upper eyelid, chalazion. On the lower eyelid, it is STI.
Okay. Mhm.
Okay.
Musarat, she said that they will remove the eyelash. Can you tell about this?
No, we are not referring for anything like that.
Mm-hmm.
Okay.
So they
It
will
is
be
not
the
it's not indicated in this case or in any other case. Only thing is incision and curettage. If it persists even after conservative treatment, then we have to refer. Right now, it's conservative and it's outpatient case.
So this is the chalazion, yeah?
Yeah, Teresa.
Okay.
Okay, so third case, Dr. Sumera. Mr. Malik, 19-year-old male, came to discuss his problem with you. Please proceed with history, examination, and management plan. And give me 1 minute just.
19 years old.
Yes, 19 years.
History, examination, and management, na?
Yes.
Okay. Let me know when to start, okay?
Yeah, just 1 minute.
Yeah, sure.
Your time starts now.
Okay. Hello, Mr. Malik. My name is Dr. Samara. Please tell me, how can I help you today?
Doctor, my eyes are driving me mad and I'm really bothered because of them. They are very itchy.
Mm-hmm. Okay. Could you please tell me more about it?
Yes, doctor, actually it happens like every year now. And in this
Hmm.
season, spring and summer, I get this itchy and red eyes and they are watery a lot.
Okay. So, Mr. Malik, I can understand that this condition is bothering you a lot. Tell me, like, it is present in your both eyes?
Yes, doctor.
Since how long?
Since like now 1 to 2 weeks, I'm trying to cope up with this with anti-allergics, but now, doctor, I came here.
Okay. So, you were taking oral anti-allergics or topical?
Oral.
Oral anti-allergics. Okay. Tell me that, do you have a watery discharge with it?
Yes, doctor.
Any nasal discharge?
Yes, doctor. I'm just having sneezing, sometimes runny nose.
Mm-hmm. Okay. Tell me that, do you have any swelling in your lids?
No, doctor.
Okay. Any sneezing?
Yes, doctor.
Okay. Any coughing?
No, doctor.
Any rashes on your body?
No, doctor.
Okay. In your okay. Any redness?
Yes, doctor. I have this itchy eyes and it gets red.
Okay. Tell me that, have you ever noticed the blurring of vision?
No, doctor.
Okay. Okay. And do you wear contact lenses?
No, doctor.
Okay. Oh, tell me that, you are saying that every year you have this condition. So, do you have any history of atopy?
Atopy, doctor.
Like
What is atopy?
hay fever, sorry, hay fever. Do you have any history of hay
Yes.
fever?
Yes, doctor.
And
I have in past history. Yes.
asthma?
No, doctor.
Okay. So, are you using any medication other than antihistamines?
No, doctor.
Okay. Any other long-standing illness?
No, doctor.
In your family, does anyone have similar symptoms?
Yes, doctor. My mother and my sister both have similar condition.
So, what they do for that?
Doctor, they are struggling with this also.
Mm-hmm. Okay. Sorry to hear about it. So, tell me, do you smoke?
No, doctor.
Do you drink alcohol?
No, doctor.
What do you do for your living?
I'm a university student.
Okay. With whom you live?
I'm I'm living with my sister and mom.
Okay. What is your daily dietary routine? Do you eat healthy?
Yes, doctor, but sometimes I take takeaways also.
Okay. Tell me, do you drive?
Yes, doctor.
Okay. So, is there any problem while driving?
These days, when I'm very much allergic and very watery eyes, doctor, I try to drive on my own, but I take gaps in the middle. Like I stop, then I drive again.
Mm-hmm. Okay. We will discuss about it. So, what is crossing over your mind right now?
Just it could be, doctor, any allergy affecting my eyes because it happens always in this season.
Yes, it could be. Yes, you're right. And which thing is worrying you the most?
Doctor, my exam is upcoming and it will affect my exam because I cannot read properly when they are watery.
I can understand it must be very difficult for you, Mr. Malik. And so, what are you expecting from me today?
Doctor, any drops that will stop itching and maybe something that I can use regularly for my allergies?
Sure, sure. I will definitely do that. So let's summarize. You are saying that you are having watering eyes from both eyes for the last 1 to 2 weeks, and you are thinking that might be allergy, and you are worrying because you have an exam coming up, and you want me to give some medication for it. Okay. So
Yes,
I
doctor.
want to examine you. Can I examine you?
Sure, doctor.
So, on the basis, okay. So first in the is first in the presence of complete privacy and presence of Ron, I will like to do vitals of the patient. Then I will check, examine the patient eye. Okay, I will see the redness, and I will see the pupillary right reflex. I will check the visual acuity. I will check the extra movement of the extraocular muscles. I will also check the accommodation, and that one, the back of the eye. Okay.
Okay.
So any
Okay.
findings?
I paused the timer sending in the group.
You are sending in the group. Okay.
Hmm.
Just 1 minute. Uh,
Okay, your time starts now again.
my picture is still loading. Okay, leave it. Okay, no
Okay.
problem. No problem, no problem. Okay, so Mr. Malik, on the basis of your history and examination, what I think that is that you have a condition which we call allergic conjunctivitis. Do you know about it?
Okay.
Do you have any
Yes, doctor,
idea?
it's kind of allergy. Yeah.
Yes, you are right. Yes, you were right that it is a kind of allergy, and it is a allergy of the conjunctiva, which is a thin membrane in the outside of the eye. Okay, so it has since you are having a history of every year this is happening, so I would like to give you few advices. First of all, wash your eyes, okay, with the cold water. Okay, with the cold water, and try to avoid allergen. Maintain a diary. If you feel that it is happening every
Hmm.
year, then you note that what is a trigger. Maybe it is a pollen, or it is a something,
Hmm.
any allergen, it must be there. Okay, and try to
Yes,
avoid
doctor.
rubbing your eyes. Okay,
Okay.
if you are it is hurting you, then you can do the cold compresses multiple times of the day, like for example 3 times of the day. Okay,
Mm-hmm.
and one more thing is that I am giving you artificial teardrops, which you have to apply at least 3 to 4 times a day, daily, till 5 days.
Mm-hmm.
And I am also giving you topical anti-allergy drops. Okay, and
Okay.
which you have to apply twice a day. And I am also giving you one ketotifen eye drops. Okay,
Okay, doctor.
and you have to come to me in my clinic after 1 week. And in between
Mm-hmm.
that, if you feel that you are having blurring of the vision, if you are having that blurring of vision and deterioration of your vision, that you can come to me, or you can come to me the emergency. But one more thing is that try to avoid driving. Okay, when your
Okay.
condition will improve, then you can drive. Okay, because it is because it will be hazardous for you and for others on the road. And one more thing is that since your exam are coming up, what we can do is that I can write a sick leave to your principal of the college, so that you can take a leave for about 1 week till your condition settles. Is it okay with you?
But doctor, they won't give me any leave for my exams.
Who told you that they will not give you leave?
Our
So if
our university doesn't allow in exams.
okay, so can you manage the writing? Can you read? Can you write?
I hope with this medication I can manage.
Okay, let's see. So if your condition will not improve after 1 week, and if you are difficulty in writing and reading, then I will come to me. Then I will write a sick leave. Is it okay?
Okay, doctor. Sure, doctor.
Okay. Then see you after 1 week. Thank you for coming.
Thank you, doctor. 1 minute remaining still. Do you want to add anything, Dr. Samara?
Okay. So since your family is also having this kind of episode, so it is better to bring them also. We will do the one allergy test. Okay, skin patch
Okay.
test or skin prick test I will like to do, because it is
Okay,
occurring
doctor.
again and again every year.
Mm-hmm. All right.
Okay, therefore.
So, okay, doctor. Thank you. Dr. Sumera, why didn't you call their family and to get a prescription instead?
Yes, I actually wanted to do that also, that for investigation and the further treatment.
Hmm.
Yeah.
Okay. Nicely done. Very nice flow in the data gathering. And this is a very straightforward case, allergic conjunctivitis, one of the very common cases coming in OSCE. Young patient, mostly teenager, with itchy eyes, becoming red, watery, associated with sneezing, runny nose, mostly spring and summer season. We need to rule out other associated factors like pain, especially facial pain, for any sinusitis, headaches, or unilateral discharge. Okay, or any discharge. Okay, here it's watery discharge, past medical of hay fever, family is suffering, he's a student. Okay, so yeah, his concerns were addressed. So in examination, again, you will see eyes, periorbital, lid puffiness if it's there, nose also. In this allergic conjunctivitis, don't forget nose to check any swollen nasal mucosa and pale looking nose. Provisional diagnosis is seasonal allergic conjunctivitis or just allergic conjunctivitis. Tell him that as you already know about your condition coming back in this spring and summer season, more likely you are allergic to something like especially pollens, as you said. Maintain a diary, very well done, because patients of recurrent attacks of anything like in migraine, like allergic conjunctivitis, or any other allergy like asthma, we need to maintain a diary. Even IBD or IBS. So avoid the allergen. Sunglasses for the outdoors. Ask him like, when do you get this symptoms a lot? So one important thing, we can offer him sunglasses for the outdoors to protect him from pollens when he gets back home. Try to take shower and change your clothes, and try to wash your eyes with the cold boiled but cooled water. Okay.
Hmm.
Topically, we can give him antihistamines or any dual action eye drops, okay,
Okay.
like as
I just have a question.
azilastine or sodium chromoglycate. Yeah.
Okay. Do we need to mention the name of the antihistamine drops?
Not the trade name, the actual
No, no.
formulatory
Generic
you
name.
can
No, no.
mention.
I'm asking the generic name. Which generic name I should mention? Because in the oral,
Hmm.
we say cetrizine or loratadine or something like that. But for the topic, nafazoline drops, I think.
Azilastine.
No? Nafazoline drops.
Azilastine. Yeah, there are so
Acinestin.
many, Nafazoline or azilastine or
Okay.
olopatadine. There are many, just use one. And
Okay.
with sodium chromoglycate can be given. Okay, orally
Okay. Yes, I
for
got
his
that.
condition, yeah, non-sedating antihistamines, especially cetrazine for systemic symptoms like runny nose. If there is no systemic symptoms, like no other symptoms, not any runny nose, then you can just give topically. But he's sneezing, having runny nose, then you need systemic antihistaminics. Artificial tears can be given to just dilute the allergen and soothe. Safety netting, tell him if there is any kind of pain, photophobia, decreased vision, then urgent follow up. In this
Okay.
case, Dr. Sumera, mostly when people are going through pollen and these allergies, we don't give 1 week of sick leave because mostly it's not
Okay.
acceptable. Symptomatic
Okay.
relief can be like in 1 to 2 days. This condition symptomatically it will go away in 3 to 5 days on its own, but if we give this medication, it's 1 to 2 days he gets better. So it's good
Okay.
that you said about the sick leave. You can give it, but not for a whole week.
Okay. And one more thing is that sick leave we have to give in case of bacterial conjunctivitis, no?
Yes,
Not the
yes,
allergic and the viral.
yes, because it is not in allergic. Viral can still be given
Okay. Okay.
because it's spreading to other people, right? And tell him to not share towels or don't rub your eyes and just try to take cool baths for the eyes, use these drops, and safety net. In this case, there is another agenda, like his mom and sister is suffering also, so tell him to bring them also. And again, any allergic case, tell to avoid triggers, close your windows because it could be pollens, wash yourself when you get back home, cover your
Hmm.
eyes. That's all. Okay. What could be
Okay,
the
and
key differentials?
okay, I said the skin patch test or skin pick test na, for the family and the
Doesn't need that.
doesn't need.
It,
Okay.
yeah, not needed in this case because it is very clear, mostly pollen allergy. You
Okay,
do
okay.
that when you don't find the allergen.
Acha. Say, okay.
It
Okay.
could not be seasonal. It could be from, the pets or the carpets or anything at home, she will be, tagging it to the seasonal. It could be anything at home as well, isn't it?
Yeah, yeah,
But
yeah.
see,
But
but
in this, it's on
huh,
history. He said that he gets better when he gets home. So
Yeah.
mostly it's outside factor. But again, if he says that when I'm sleeping, I'm getting it at night, then yeah, pillow
no, and the
covers,
patient was
carpets.
saying also one thing that doctor, I got in the season autumn, I think. You said na autumn
Yeah,
or spring.
spring and
So,
summer.
Yeah.
spring and summer. Okay.
Dr. Masala, just one thing. What could be the red flags in this condition apart from, the visual impairment or, the white discharge or something? What could, be the specific red flag we should be, aware of, or the patient should be aware of?
Mostly the pain, painful eyes, or excessive watering can be controlled, but vision loss. And if he's driving, then need to be very cautious during driving.
Okay.
Otherwise, in allergic conjunctivitis, you don't have any severe red flag. But if systemic features are there, fever, headaches with that,
I think there's
then
one variant of it. We call it the giant papillary, something like that. That one, which, yeah, I think it has a
Mhm.
specific symptom. I'm forgetting that. Like it is better in the morning or worse in the morning, something like that. So like this could be one of red flags, isn't it?
Yeah, it could be. Like there, I don't know which one you are talking about, but it could be chronic in cases.
Okay, got it.
Okay, in this case, the differentials can be allergic conjunctivitis and viral conjunctivitis, bacterial, and just the dry eye. Okay, viral will come with the watery, gritty, red eyes, and it's mostly started unilaterally. Then it goes on to the next eye, where allergic just comes with the bilateral. Okay, in bacterial, there is prominent mucopurulent discharge, and dry eyes is mostly like chronic gritty or burning sensation, and also vision and fluctuating vision with the minimal discharge can present dry eyes, keratoconjunctivitis, Zika. Okay. If you are getting patient with the dry eyes, then ask for the screen usage. Long term screen usage can be one of them. Okay, so next case, who wants to do?
Can I do?
Dr. Aksa, you didn't do
Yes.
yesterday. Okay,
Yes.
so your patient is. Hmm. Mrs. Nora, 60 years old female, came to discuss his problem with you. Her problem with you. Please proceed with history examination and management plan. Your time starts now.
Okay. Hello, Mrs. Nora. My name is Dr. Aksa. I'm one of your physician here. So what brings you here today?
Doctor, my left eye started hurting badly. I just cannot bear the pain.
Mm-hmm. So, Mrs. Nora, can you tell me more about this?
As doctor, since few hours, it's hurting really bad, and it's now red, and I cannot see properly. And the lights have like I see rings and around them.
Mm-hmm. So, Mrs. Nora, can you tell me that was a sudden or gradual in onset of your pain?
It's sudden, doctor. As soon as I woke up today.
Okay. And can you describe the character of your pain?
Doctor, it's just a really sharp kind of pain. Like
Okay. So, are
Yeah.
you comfortable to sit on the chair, or would you like to lie down yourself on couch?
Doctor, I just cannot even sit or lie down. It's really bothering me. Even when I'm lying down, it's really bothering me.
I can understand. So, Mrs. Nora, can you rate your severity from 0 to 10? If 0 is minimum and 10 is severe.
Doctor, it's 9 or 10.
Okay. Ms. Nora, is this pain is going somewhere else?
Uh, no, doctor.
Does anything aggravates it?
No, doctor. It just came on suddenly.
And do you take anything for is it's relieving?
No, doctor. I didn't take anything. I just came here.
Okay. Ms. Nora, is it associated with any nausea and vomiting?
Yes, doctor. I vomited once.
Okay. And any vision loss?
No, doctor. But I feel blurred vision.
Any gritty sensation in your eyes?
No, doctor. But I see halos around the light.
Okay. Do you get hurt at your left eye?
No, doctor.
Okay. Do you use using contact lenses?
Mm, yes, I wear reading glasses, not contact lenses.
Okay. And what eyesight is your weak? Is it far or near?
Sorry?
What's your eyesight? I mean, you are a nearsighted person or far-sighted person?
Doctor nearsighted. Sorry, farsighted at this age.
Okay. So, Mrs. Nora, do you have any other long-term illness?
Doctor, I have this high blood pressure and high cholesterol. I'm taking medications for it.
And are you compliant with your medications?
Sometimes I forget, doctor.
Did you check your BP?
No, doctor, not recently.
Okay. What you take medications and how much dose?
Doctor, I'm taking this Remipril and
Hmm.
atorvastatin 10 milligram, 20 milligram.
Okay. And is there any similar kind of illness which runs in your family?
Mm. Doctor, my aunt had similar condition. She had painful eye. She went to doctor. Doctor, I cannot tolerate the pain. Please do something.
Okay, I can understand, Mrs. Nora. I'm going to give you. Do you have any kind of drug allergies?
Doctor, no.
So I'm going to give you an injection diclofenac IM at once. Now, after that, I'm going to ask few more questions. Mrs. Nora, is it okay for you?
Sure, doctor.
So, Mrs. Nora, can you tell me about what do you do for your living?
Doctor, I live at home. Don't do anything.
Okay, and do you smoke?
Yes, doctor.
How many cigarettes?
10 cigarettes since last 30 years now.
And do you think any intention about quitting?
No, doctor.
Okay, we will discuss these things at another session. Okay, Mrs. Nora. And what about your diet?
Doctor, I'm taking normal diet, but sometimes I'm not taking care of myself enough.
And are you doing any physical activities for yourself?
No, no, doctor.
Okay, Mrs. Nara, so what is you have an idea about your this condition? Do you have any idea?
Doctor, I thought it's kind of any migraine or, but at first, but now eye pain is really awful. I just cannot tolerate.
I can understand it must be showing from your face also, Mrs. Nara. And what do you have concern from me today?
Doctor, I'm scared. I'll lose my sight somehow.
Okay. And what were you hoping from my side?
Doctor, any medication or just give me any hospital admission?
Okay. And how these things is going to affect your life?
Doctor, just I don't know what's going on with me. I'm really scared.
Okay, Mrs. Nora. So let me summarize for you that you are suffering from a sharp, intense left eye pain. That is what is sudden in onset, and you are suspecting that you are a hypertensive patient, and you are suspecting that you are having a migraine. You have a concern for losing your eye, and you want some investigations. Would you like something in your exam? Would you like something add from myself?
No, doctor, only just doctor. I just started this nasal decongestion recently, and I'm taking it over the counter. Just only this. Otherwise, I
Okay.
told you everything.
Which these congestions you are taking, please can you tell me? Do you know the name?
Nasal decongestant.
Okay. Okay, Mrs. Nora, I would like to examine your eyes. Is it okay for you?
Sure, doctor.
I would like to take first of all your check your blood pressures and RBS, sorry, blood sugars also, and I would like to examine your lid and looking at your conjunctiva, cornea, and especially at your pupil size for any dilatation or constriction. And I would like to check with light. Is it okay for you? If you are having a pain, so please let me know. I will stop my examinations, Mrs. Noora. Is there any finding?
Yes, blood pressure 170 by 100. Affected
Mm-hmm.
eye markedly red. Ciliary injection is there. Cornea
Mm-hmm.
hazy. Pupil mid dilated, non reactive. Okay.
Mm-hmm.
Or
Mm-hmm.
you can say sluggishly. Very tender and markedly vision reduction.
Okay. So, Mrs. Nora, after the examination and the history that suggesting that you are suffering from a condition that is called is acute angle closure glaucoma. Did you know about this, Mrs. Nora?
No, doctor, what is it?
It's a kind of condition where eye water getting increasing and it is going to putting pressure on your eye. That's why you are having this pain. Are you getting me, Mrs. Nora?
Yes, doctor.
True.
Hmm.
Yes, sir. Ask please. What do you want to say?
Yes, doctor. Can you do something for this?
Yes, Mrs. Nora. With whom you are came here?
I came alone with my
Uh,
driver. So.
Okay, so I would like to refer, I would like to call someone in your from family and I would like to refer to the hospital urgently because it's an emergency condition. Are you getting me, Mrs. Nora?
Yes, doctor, but I didn't tell my husband. He must be very worried. I can go back home and we can come tomorrow. Just give me any painkiller.
No, Mrs. Nora. Try to understand. It is very important for your eye health, and I would like to call your husband also and inform him about your condition. Meanwhile, you have to go to the hospital because otherwise, if you are not going to the hospital, these pressures put these water will increase and put pressure on your eye, and you will be lost your eye. Are you getting me, Mrs. Nora?
Okay, doctor.
After the getting discharged from your hospital or after the getting a specialist input, you can come back to me. We will discuss some another management plans along with this, and we are also some another management plan about your high safety. Is it okay for you, Mrs. Nora?
Sorry, what did you say?
If you are getting discharged from the hospital, once you get
Mhm.
discharged from the hospital, then you come back to me and I will discuss some
Okay.
another management plans for your this eye condition.
Okay. Doctor, what medication they will give me there?
Okay, they are going to first of all they are going to do some investigation where they want to see how much eye pressure is there. They will check your
Mhm.
intraocular pressures by some techniques like goniometric and goniometries, and then they are going to put some of the medication where they are going to decrease your pressure. And in the future, you need to avoid these kind of nasal decongestants also because they are also putting in and increasing your eye pressure also. Are you getting me, Mrs. Nora?
Yes, doctor.
So maybe they are going using some topical eye drops, or maybe
Time's
they
up.
are going time up.
Okay. Yes, time's up. So, if I ask you, Dr. Aksa, do I need any surgery, doctor?
That will be assessed by the specialist. If they are not, you are not getting relief by the some oral medications or topical medication, then definitely they will do the surgery. That is called, I think, trabeculotomy or
Okay.
dotmy. Not exactly, I
Okay.
don't remember.
Okay, I couldn't hear you at the very end, but okay, Dr. Aksa, nicely done. Let's go from the beginning. History. This is, yes, acute angle closure glaucoma. Painful red eye with halos around the eye and high blood pressure. So one of the differential is acute angle in this case. This patient again, as we starting asking for any painful eye, ask for sudden and gradual onset pain, blurring of vision, halos or floaters, um, headache, nausea, vomiting. In this case, vomiting was there. Past episodes, there could be some past episode, milder discomfort or blurry vision, but when it's acute, it's severe. Medication, she's taking over the counter decongestant, and past eye history was wears the reading lenses. Her risk factor is high blood pressures and family history. Okay. Again, in the examination, if there is written an examination, you have to verbalize it. You're not going to do it, but if you verbalize, you will tell, I want to check your vitals. I want to see the appearance of eye, cornea, your pupillary reaction, and palpation of the eye. Gentle palpation is very important. And again, very good thing in your examination, you said, stop me in the middle if you feel the pain. This is very important for any acute painful conditions. Vision markedly reduce. So in investigation here, you won't do anything. In primary care, do not delay referral even to measure intraocular pressure. Okay, at hospital, they will be checking your intraocular pressure, checking your back of the eye, etc. Same day referral. Do not dilate the pupil. Do not delay for doing any test. But explain to the patient that it's the pressure inside of your eye is dangerously high, and you need to get treated urgently to relieve the pressure and to protect your sight. Okay, if the patient is telling you, no, I want to go back home, no, it can even cause you blindness. So, right now, I'm sending you, and I'll be informing your husband, or if you can call him to accompany you. Meanwhile, in hospital, you can mention the names of the drugs they will give. Intraocular pressure lowering agents like they will give you drops like pilocarpine or acetazolamide. Okay, but this condition needs surgery. Okay, at first they will reduce your symptoms, and meanwhile they will do the laser iridotomy. Okay, a laser operation that will clear your area from where your pressure is building up. Okay, blockage. And also somehow you can also state it might if they ask, doctor, they do in the one eye or the other eye also? So other eye needs prophylactic iridotomy also. Okay, so the operation will happen in both the eyes. Safety netting inform about the high risk of the other eye, and that's why prophylactic treatment is needed. And I want to see you as soon as you get back from there. We need to talk to you a lot because post eye operation or needs a follow up and proper management, since she is high blood having high blood pressures, and lipids need to run some baselines for that also later in the follow up. Otherwise, nice. And LMP. Any female, don't forget LMP because there could be some light spotting or any bleeding from down below, and patient is ignoring it. So 50 plus or any case, a female needs to ask LMP.
Dr. Musarat,
Yes, doctor.
acetazolamide injection cannot be given by the GP.
No. As far as I
Okay,
know,
so
I don't
it's
know about the local guidelines, but no delaying in referral for any injection or painkillers.
okay.
Okay. Because
Dr.
it's IV and you are going to just refer the patient.
I have a question that in case of
Mhm.
eye trauma or any kind of eye pathology in which there is a pain, patient is saying, doctor, I have so much pain, and the tertiary hospital is little far, then in that case, can we give any painkiller or which painkiller?
It depends which kind of trauma is it. If it is foreign body, then you're not going to do anything. Even if you are giving them any muscular pain relevant, it won't relieve the pain. You are sending for the emergency. Secondly, if there are chemical burns, then you can give topical analgesics. Okay. For chemical burns,
Chemical burn.
you are not
Okay.
treating it, but you have to wash the patient with 0.9% saline, wash it off from 1 to 2 liters, then send the patient. You can give topical analgesic in chemical burns. So it depends case to case. Dr. Asba, you want to do the case?
Dr. Musara?
Okay. Yes, Dr. Simon.
I have a question. Like, for example, in case of blood pressure, for example, in case of CVS examination, and if we ask the patient that I want to see you at the back of your eye, like with the fundoscope, of course, we will turn off the light, everything. But do we need to tell the patient like I will put the drops for the dilatation, or no? Because you told us now that we will not put the dilator drops. Am I right? So what we will do?
Depends. In glaucoma, you are not putting drops. Okay.
Mm-hmm.
But in normal eye or fundoscopy, where there is no eye problem right now, but to check on the back of the eye, don't mention it.
Mm-hmm.
Don't mention fundoscopy that I am going to dilate your eye. No,
Okay.
no need of it.
Okay. And in my case, like the external hodulum, what I have read that if it's not working, we have to remove that a single eyelash to to drain the.
Yeah, drain it.
Okay.
Yeah. But again, Dr. Saima, it depends. Like
Yeah.
it can be
If
done
we.
before conservative. Okay.
Yes.
And incision and curettage is again the word of choice. We will not tell the patient how it's done. So that's why I was avoiding the lid removal or things like that. Just tell about incision and curettage. It will cover all of it.
Like for example, if
Okay.
the patient asks that what they will do there, so we can mention.
Yeah, they will drain it by giving a small incision, drain the
Mhm.
pus, and you will be perfectly fine. Choice of
Okay.
words is very important in this exam because the SP will ask you like they will remove all of my lashes or any extra question will come, so it will be time consuming.
Okay.
We need to
Okay.
just say what's needed, incision and drainage, typical word. That's all.
Mhm. Okay.
Okay, in this differentials will be okay, acute angle closure glaucoma and acute anterior uveitis. Again, it's a referral. Infectious keratitis or corneal ulcer and scleritis. These are mostly referral. Scleritis, you will feel severe boring eye pain and but normal pupil. Infectious keratitis or corneal ulcer, there will be photophobia and obvious ulcer on fluorescein staining. In acute anterior uveitis, you will see painful photophobic red eye with small or constricted or irregular pupil. But ciliary flushes, their intraocular pressure is not increased in that. How you would know that pressure is increased when you palpate the patient eye? It will be like hard, and patient will tell you it's tender eye. Please don't touch my eye in glaucoma. Okay, so should we move on, Dr. Ambreen?
Yes, ma'am.
Okay, just give me a minute.
Dr. Surat, in this condition, can we give injection diclo to the patient to relieving the pain? Is the patient get benefited or don't we don't need to give?
Again, it's not in the guidelines, but I don't know about the local ones. If it's locally practiced, so we can give. Otherwise, in the guidelines, it's not mentioned. They are saying do not delay to do anything
Mhm.
at primary care. Refer the patient.
So you are saying now that any type of painkiller will not help the patient because it is an intraocular, one. The pathology is in the intraocular liquid. So
Yeah,
once
this
the
is not a muscular pain. Mm-hmm.
yeah.
It's not a muscular pain that will go away with the diclofenac because pain cause of the pain is blockage. So your painkillers are not going to do anything at all. We need to relieve the blockage. Okay. So Dr. Amreen, your patient is Mrs. Helen, 78 years old female, came to discuss her problem with you. Please proceed with history examination and management plan. Your time starts now.
Okay. Hello, Mr. Helen. My name is Dr. Amreen. How can I help you today?
Yes, doctor. Actually, when I read or look at straight lines, it becomes wavy.
Okay. Can you tell me more about it?
Yes, doctor. Actually, since it's been going on since last month now, and whenever, especially in my right eye, and it's been getting worse over a few weeks. I was thinking it could be some any sensation in the eye or anything that's bothering me, but no, it's in from the inside of my eye. I feel like there's something wrong with my eyes.
Okay. Can you tell me that? Do you have any pain?
No, doctor.
Okay. Do you feel this sensation, feelings in the one eye or both eyes?
Doctor, no, not sensation feeling. It's just bent or wavy eyes, straight lines in the right eye.
In the right eye. Okay. Your
Yeah.
left eye is completely fine.
Yes, doctor.
Okay. Uh, can you tell me that? Do you have any watery eyes?
No, doctor.
Do you have any discharge?
No, doctor.
Okay. Uh, you told me that you have such episodes last month. Is it so?
It's since a month now. It's getting worse and worse.
Okay. Mean you said condition is continuous.
Yes, doctor.
Okay. Uh, can you tell me that if you when you wake up, the condition is worse, and what about your VN?
Doctor, my vision is like when I'm reading, the page look
Yes.
a bit distorted and the straight door frames looks bent to me somehow.
Okay. Uh, can you tell me that do you feel sticky in your eyes?
No, doctor.
Okay. Uh, can you tell me that do you feel redness in your eyes?
No, no,
Okay. Can you feel any headache?
no, doctor.
Okay. Do you have any fever?
No, doctor.
Any neck stiffness?
No, doctor.
Okay. Can you tell me that have you visited any doctor for this condition?
No, doctor. It's just I came here.
Okay. It's your first visit.
Yes.
Okay. Uh, can you tell me that do you have any long-term illness?
Yes, doctor. I have this high blood pressures, and I used to smoke, but I left it
Okay. Since how long you left the smoking?
since 5 years now.
Okay. Can you take any medication for your blood pressure?
Yes, doctor. I'm taking this calcium channel blockers.
Okay. Are you taking regularly your medication?
Yes, doctor.
Okay. And do you check your blood pressure now?
No, doctor. I didn't.
Okay. Uh, can you tell me that what do you do for your living?
Mm, doctor, I just stay home. I don't do anything.
Okay. Whom do you live with?
With my husband.
Okay. Can you tell me that do you have any other eye problem?
No, doctor. Sometimes my vision. It feels like when I'm looking at something, I feel central area is missing.
Okay. What about
Hmm.
peripheral vein?
Peripheral is fine.
Peripheral is fine. Okay.
Hmm.
Uh, can you tell me that do you use any glasses?
Yes, doctor.
Okay. For what uh,
For
reason?
reading,
For
I'm
reading.
reading. Hmm.
Okay. Uh, can you tell me that can you use contact lenses?
No, doctor.
Okay. Uh, can you tell me that you have any surgery in the past done?
No, doctor.
Okay. Uh, can you tell me that are you diabetic?
No, doctor.
Asthmatic?
No, doctor.
Okay. Can you tell me that any do you have any family history of any eye problems?
Yes, doctor. My mother had similar problem. She started losing vision in one eye, then it happened to her another eye also. So they were giving her vision aids. She went to vision clinics. So I don't know what was she going through.
Okay. Okay, Miss Ellen, don't worry. I
Mm.
understand your situation. I'm here to help you. Uh, uh, can I ask you that what is your main idea that what you are having?
Doctor, I know that I have some kind of eye vision problem, but this seems worse.
Okay. What are your major concern about it?
Doctor, maybe I'll go blind and lose my independence.
Okay. And what do you expect me to do? What are your
Any quick
expectations?
referral for any injections? Doctor, can you send me for any injections?
Okay, okay, Miss Helen. Don't worry. I'm here to help you, and I can do as much possible treatment and referral uh, as possible. Do you mind if I examine you?
Sure, doctor.
Okay. I can check your vitals uh, and mainly blood pressure because you didn't check at home. And I can check your eye examination. First, I see your visual acuity and
Mm.
visual fields and peripheral vision, and I can check your eye movements, and I can check your I can check your generally I check your any swelling on the lids and any redness, and um, I can especially do a fundoscopy because you
Mm.
already said that you have floaters and curtains in your feeling in your eyes. Is there any um,
Okay.
findings?
Visual acuity is reduced in the right eye, especially central. Fundoscopy, right
Okay.
macular, uh, grayish membrane, and there is fluid, suspicious of uh, age-related macular degeneration.
Okay. What about blood pressure?
Normal.
Okay. Miss Helen, as I examine you and you have decreased visual activity, I understand that your VN is gradually decreasing. Firstly, because as VN is decreasing is a very major concern for me. So that's why I uh, try to refer you because I'm worried about your VN. And as you had a strong family history, so it's very much concerned that you might have can involve your other eye. So, um, is there anything you want to ask? Can you get it?
Doctor, yeah, but what will they do over there?
Okay, I can give you uh, some painkillers. According to me, I think you are going to have retinal detachment in your eye, and
Mm.
as is the progressive condition, it might get worse. So that's why I'm going to refer you to the specialist for your condition. And as you're using glasses for your eyes condition, so I'm confused. Uh,
Mm-hmm.
uh,
Okay.
Before referring, I just tell you something that there must be they give you some medications and give you some drops and might give you some options of medical for your medicine, and some you give you some surgical treatment if it not gets better, and if you think that it might getting worse.
Okay,
In the
doctor.
meantime, you
Time's up.
can time's up.
Yeah, you can finish, Doctor Amreen.
Okay. At the end, I just tell you that you can, meanwhile, after getting your treatment, you can get back to me and we can discuss it. That what can I help you to
Mm-hmm.
further improving your condition, and just to get it right and not back to the worst situation. We can keep in touch for your condition, and meanwhile, you can take your medication for your blood pressure regularly, and just keep in your mind just some red flags that whenever you feeling you are getting headache, you are having fever, your eyes your vision is getting blurred, and or you are having you didn't see anything and you vision might be lost. So these are the red flags that for you whom you need to consult nearby emergency or come back to me immediately. uh, you get it?
Okay. Okay, doctor. I get it.
Okay, anything else you want to add or you
No,
want to
doctor.
ask?
Oh, no, Doctor Amreen, time's up.
Okay.
Okay. So today you asked about eyes. That was nice thing. And if you go from the beginning, it is age-related macular degeneration. What was your diagnosis?
I said that it was retinal detachment.
Mm-hmm.
I
It's
just gently
age-related.
go back to floaters and curtain-like feelings.
Yeah, but she wasn't having anything like that. One key word in this case, patient will tell you, I see straight line as wavy, number one. Or I
Okay.
cannot recognize the faces of the people, like it looks blurry to me. These 2 points together, it's race related macular degeneration. It's mostly in old age people. Okay, so we can ask since, and it's a gradual loss of vision. So
Okay.
that's how you'll get the case from the very beginning. But now it started about a month ago, and you didn't ask for any decrease of vision previously, did you?
Yes, I asked
Okay.
that. I, yeah.
Okay, it was
Uh,
a gradual
Ma'am,
vision
is
loss,
her
but
peripheral vision is okay and central vision is
hmm,
affected?
yes,
Okay.
to
And it's
recognize
the
the
main
face of the
point,
people.
key point of macular degeneration.
Yes, one of the key points. And this is unilateral symptom, central blurring, no pain, no flashing of the eye. So Amsler grid. Okay, you can say I want to do Amsler grid where it's a wavy lines, oh sorry, straight lines with the center black spot. You will tell the patient to focus on the center spot, then the eyes, then the lines will be wavy. Okay, this is positive in this case. The patient will tell you distorted or missing central area in the right eye. Okay,
Okay.
past medical history, high blood pressure, excess smoker, and sometimes patient will tell you that I have this dry AMD since a few years, but sometimes patient doesn't know, and it changes into wet macular degeneration. So always macular degeneration start from dry, like drusen, etc. Then it goes onto the wet macular degeneration. Family history is very important. She already has mother who
Mm.
had similar condition. If they tell you
Mm.
I'm having one eye problem, then it's getting to the and the next eye, the other eye. That yes, it's definitely macular degeneration. She was
Okay.
living with her husband, reading and driving even though patient is 80 or 90 or 100, we need to ask for the driving, and she is still driving. We have to tell her that not to drive in this case somehow until her condition is better, or we are liaising her to the departments. I'll tell you in the management plan. Okay, so
Okay.
examination visual acuity fundoscopy, where they will either give you the drusen's appearance on the fundoscopy, or as I told you, like wet uh, age-related macular degeneration, no eye pain, or no redness of the eye. How we
Okay.
investigate? Nothing. You have to do nothing over here. You are sending the patient urgently to the ophthalmology for further workup. In primary care, just recognize that this is age-related macular degeneration. Just have to send the patient to the ophthalmology. Patient is asking what they will do. You have to tell the patient for injections, as she already said. Tell anti-VEGF, like vascular endothelial growth factors can be given. Okay. Then tell the patient, I
Okay.
also want to liaise you with the low vision aid clinics. Tell them about the lighting of the room, to use rails when going to the toilet, and to read in the high increased light or a good lighting room. Okay, and emphasize on the time sensitivity of the treatment. Tell her that in this is in one eye, it can go into the other eye, so we have to keep a close follow up. Also tell about the smoking cessation, improve diet rich in leafy green vegetables, and they can also add some supplements like vitamins for her visual, especially vitamin C, E, zinc. You can mention the name just. Okay.
Okay. But you didn't give any treatment at the clinic.
No, we don't. Just
Okay.
refer for the vision aid clinics, ophthalmology department, and safety netting. Tell her to get back. We need to talk about your smoking cessation, your diet plans, and your lifestyle. Tell her not to drive until you get appointment or specialist input. Okay.
Okay. Okay.
And yes, one important line in this whole case: come back to me as soon as you feel loss of vision in the other eye, because it will be very quick. Okay.
Yes. Okay.
So the last case who wants to do, and yes, one
May
important thing, Dr. Ambreen.
Yes, ma'am.
Dr. Ambreen, your patient, you will keep on asking, can you tell me, can you this? Don't ask like this, like it will take a lot of your time.
Okay.
Mr. David, do you have any eye pain, any discharge,
Okay.
any loss of vision? Okay. Do you use
Okay.
glasses? Don't tell him, like, can you tell me, can you tell me? It will be like
Okay.
interrogating mostly. Okay. Otherwise, you
Okay.
improved in the history and eyes, and just get I don't know how, but you will improve in the diagnosis making after every case. I hope it's helping
Okay.
everyone.
Yes.
Can I do, Dr. Musala, that there is case?
Yes, who is this doctor?
Hafsa.
Like, Dr. Hafsa. And the differentials of the age related maculars are diabetic macular edema, like it will be with the diabetic case. There will be changes like microaneurysm, hemorrhages, macular thickening. We need to address diabetes in that. Cataract or optic neuropathy is one of the differentials also. Okay. So last case. Mm. So your patient is, sorry, my laptop is a bit slow. Yes, Mr. Arthur, 75 years old male, came to discuss his problem with you. Please proceed with the history examination and a management plan. The time starts now.
Hello, Mr. Arthur.
Hello, doctor.
I am Dr. Hafsa with you. How may I help you today?
Doctor, I've noticed my vision getting more cloudy over the last year now.
Okay, Mr. Arthur, can you please tell me more about your condition?
Yes, doctor, it's bothering me, especially when I'm driving at night. And it's something, they said something is in my eyes. I don't remember the name, but it's causing me blurry vision. And sometimes I get glare and halos around the headlights at night.
It can be very difficult for you then to drive.
Yes, doctor.
Yeah. Okay, so this blurry vision, is it in one eye or is it in both eyes?
Mostly both eyes I'm feeling
In both eyes. And since how long?
since 1 year now.
Since 1 year. Is it getting worse day by day?
Yes, doctor.
Okay, apart from this blurry vision and the flashes of light, do you have any pain in your eyes?
No, doctor.
Any redness?
No, doctor.
Any watering from eyes?
No, doctor.
Headache?
No, doctor.
Fever?
No, doctor.
Any kind of surgery you have done for eyes?
No, doctor.
Okay. So tell me, do you have any long-term medical conditions?
Doctor, I just have this high blood sugars, but it's controlled and high blood pressures.
Okay. So what do you take for these blood pressure and sugar?
Metformin, Ramipril, and simvastatin.
So do you take them regularly daily?
Yes, doctor, but sometimes I forget also.
Okay. And do you follow up with your doctors?
Yes, doctor.
Okay. And is it controlled, the blood pressure or the sugar?
Yes, doctor, I'm doing daily diet and exercises also.
Okay, that's very good. Any family history of any eye problems?
No, doctor.
Okay. And tell me, do you smoke?
Mm, no, doctor.
Do you smoke?
Hello? No, doctor.
Hello?
Hello, am I
Yes.
audible?
And do you drink alcohol?
No, doctor.
Yes, I can hear you now. Do you drink alcohol?
No, doctor.
Okay. And you said that your diet is normal? Hello?
Yes, doctor. Yes.
Hello?
I'll pause the timer over here. Dr.
Hello?
Hafsa, am I audible? Am I audible
Yes,
to other people?
yes, you are audible.
Okay, so
You both
maybe
are
for
audible actually.
okay. Dr. Hafsa, can you hear me?
Dr. Masarat, can you hear me?
Yes, I can hear you. Can you rejoin because I feel like it's from your side? Okay. Okay, so she did not rejoin. Maybe it's connection problem.
I am Dr. Hafsa with you. What can I do for you today?
Doctor, I've noticed my vision getting more cloudy over the last year, and especially when I'm driving at night.
Okay. Can you please tell me more about your condition?
Yes, doctor, it's been few like months, It's getting
Mm-hmm.
blurred more and more, cloudy vision, and I get glare and halos around the headlights at night. And I cannot like see colors completely. They are fading away.
Mm-hmm. Okay, is it in both eyes?
Yes, doctor. More worse in the
Apart,
right eye.
okay, what's in the right eye? Apart from this blurry vision, is there any pain,
No, doctor.
any redness,
No, doctor.
fever,
No, doctor.
headache?
No, doctor.
Okay. Do you have any long-term medical conditions?
Yes, doctor. I have this high blood pressure and diabetes.
High blood pressure and diabetes. So what do you do for that?
I'm taking metformin, ramipril, and simvastatin for that.
So do you take them daily regularly?
Yes, doctor. Sometimes I forget, but I'm taking diabetes medication regularly.
Okay. And did you check your blood pressure or the blood sugar level last time?
Mm, no, doctor, but I feel it's controlled because I'm doing gym and exercises.
Okay, that's very good to hear. Okay. Any family history of eye problems?
No, doctor.
Do you smoke?
No, doctor.
Do you drink?
No, doctor.
And how about your diet in general?
I'm trying to take good diet, like not takeaways or junk food.
Okay, that's very good to hear. With whom do you live?
I live with my wife.
And everything is okay?
Yes, doctor.
Okay. And what do you do for living?
Um, I drive to shops and sometimes I deliver the
Mm-hmm.
products. Yeah.
Mm-hmm. But Mr. Arthur, as you told me earlier that you are having this problem in the vision, so it is not advisable to drive in this case. Will you be?
Doctor, this is the only thing I can earn from.
Okay, tell me if you have any this. I can involve you in some social services, and you can tell me what things, what hobbies, or what things you are interested in, so that we can find another job for you. Or maybe if your wife can do other job, maybe we can do that also for you. Is that okay?
Okay, doctor.
Okay. So, Mr. Arthur, what do you think is going on with you?
Doctor, I just think it's old age.
Mm-hmm. And what makes you worry the most?
I'll go blind or lose my license because of this.
Mm-hmm. And how can I help you?
Just I want any referral to any surgery or do anything that's urgent, doctor.
Okay, okay. So, Mr. Arthur, you're telling me that for the last 1 year you are having this blurry vision and it is causing
Mm.
you difficulty in driving, and you are concerned
Mm.
that it could be because age related, or you might go blindness, and for that you want me to give you a referral for an ophthalmologist, eye specialist. Is that all?
Yes, doctor.
Is that okay if I examine you?
Sure, doctor.
So after proper sanitization, I would like to check your blood pressure, pulse, temperature, oxygen saturation, respiratory rate, and blood sugar level. And I would like to check for both of your eyes, the conjunctiva, the eyelids, cornea, and also I would like to check for the light reflex and red reflex and the back of the eye.
Okay, I'll pause the timer over here, sending the picture in group. Okay.
Mm-hmm. Mm-hmm.
And visual acuity is reduced in both eyes
Mm-hmm.
and no redness. Normal response on the pupil examination fundoscopy is difficult to visualize.
Mm-hmm. Okay. So, Mr. Arthur, from the examination, I have seen in this is one eye, or this is both eyes, the picture.
Both eye, but right is worse right now.
Okay. So, Mr. Arthur, this is what we called cataract. Have you heard about this word before?
Yes, doctor. My friend has this similar condition.
Okay, so as you were concerned that it could be age related, you are right. It could be because of the age related, and in some patient, it could be also because of using some steroid, which you are not using, and it could be also because of the high blood sugar level, as in your case, because you are non-diabetic. So it could be the
Mm-hmm.
reason because of this. So now it's very important that we can refer you to the ophthalmologist, eye specialist doctor, because in
Mm-hmm.
the final treatment it will be that it has to be removed surgically. So are you okay with that?
Doctor, why surgery? It's not complete loss of vision. I can still see.
You are right, Mr. Arthur, but this is a progressive condition, as you said, that you are having since 1 year, and it's day by day getting increased. So, because with the time it might get like it is now initially in initial process, but the time might come that you might have complete loss of the vision, and it will really affect your life and all above the driving. So would you like me to refer you to the ophthalmologist, eye specialist?
Doctor, I'm very scared of surgery. I don't know. Maybe this is a big surgery and it will cause me blindness also.
No, no, Mr. Arthur, it's not a big surgery. It is only a daycare surgery, so that under
Mhm.
even under topical anesthesia, this surgery can be done. You may have to stay there only for a few hours, 5, 6 hours, no more than that. But one thing, after doing the surgery, it's important for you to have a proper follow-up. Are you getting me?
Yes, doctor.
Okay. And one more thing, please. I am really glad that you are doing exercises and you are trying to reduce the weight. But it is also very important for you to have proper follow up and taking your medications for the blood pressure and for sugar. As I told you earlier, this condition it is because mostly it is because the diabetes. So it's very important for you to take care about your food. Please eat
Mm.
drink. Please eat balanced diet, less carbohydrates, less junk foods, so that your condition will not progress more.
Okay, doctor. So when am I going to the specialist right now?
No, not right now. I can fix an appointment within this 2 weeks. So then you can go.
Okay, doctor.
Okay. And as I told you, it's very important for you not to drive. You may calls upon someone to drive you because this is it will really affect the license as you were concerned about it.
Yes, doctor.
Okay. Anything else that is not clear you want me to clarify?
No, doctor, that's all.
Okay, thank you very much for your coming. And if there is any, if you find that the other vision, the other eye visions become really more blurry, then please make sure to come to us directly.
Okay, doctor.
Okay, thank you.
Thank you, doctor. I still have 2 minutes. Do you want to add anything?
No, I think I have done everything, isn't?
Okay. What if you have 2 minutes at the station remaining? What will you do to the patient?
I told him about
Yeah.
I told him about
So,
this because he's not smoking, he's not drinking. I told him about his diet. He is already doing exercises. I have given advice to about be careful about his blood sugar level and do follow up regularly. And
okay.
DNA, yeah, should not be. Is there anything I am missing?
No, there is not anything you're missing, but to kill the time, we still have to engage the patients. Like we cannot just look at the like examiners or patient's face. So somehow we have to engage for even 2 minutes. You can talk here and there. How's your wife? How's she doing? And
Mhm.
is she concerned about you? If you get the time, but mostly it's within 10 minutes. But in cases where you are not doing examination, you have to engage the patient. Somehow it's
Mhm.
awkward sitting silent over there. Yeah.
Okay,
So
okay, that's it. Yeah.
yeah, otherwise very smooth case. You done almost everything. Straightforward cataract case. Start, but here not urgent, or within 1 or 2 weeks it's not needed. Routine referral. You will tell the patient, this is not an urgency right now, so you don't need to go today. And yes, as you think that it's a old age thing, that's why it's coming onto your eyes and that's affecting your vision. It needs a surgery, and he was concerned about surgery. You addressed it very well. Like it's common surgery, usually safe and effective. But important thing, I need to see you after the surgery, because after that we have to be very careful about your eyes, like no infections and some other some other things to be taken care. Impact on lifestyle, especially driving, tell him to not drive until you get assessed, or drive in the daytime if that's be possible. No night driving. Reading, if he's reading, tell him to just not read at night. If he's reading, can do it sunlight, in under the sunlight or in the bright light. Falls risk are very important. In this case, cataract or any gradual vision loss, patient is what asked, have you ever fell or hit yourself because you couldn't see something in front of you? False risk assessment is very important. So if he says, yes, I got hit few times and I have bruises on my legs and things like that, please tell him to use any stick or any cane to guide himself until he gets surgery. Okay, you can arrange her routine blood test. If it's 2 minutes remaining, you can say, when did you go for last your sugar checkups and blood pressure? If she says not for over 2 years, then you can run blood tests, routine blood tests and baselines. Tell him that I want to run blood tests to see your sugars level and how you're doing in general health. Okay. And
Okay.
also importantly, you have to do this test in this case. Why? Because he might get an appointment for surgery. So before that, diabetes and BP control is very important pre-operatively. Since it's a routine referral, tell him in detail about the safety netting. Don't drive at the daytime, and sudden vision loss or any injury or fall again, please come back immediately. Okay, that's all for today. If there is any query, we can discuss in the group. Okay, doctors. Thank you.
Thank you for your time, doctor. Thank you.
Thank you, doctors.
Thank you, Dr.